Hello, everyone. Welcome to our presentation today. My name is Margerie Durban. I am a headache fellow at Detroit Medical Center and the VA hospital in Detroit. I split my time in both of those hospitals. And today we are going to talk about a topic that is medication overuse headache, specifically what causes medication overuse headache and how can I get out of it? Oh, that didn't work. Here we go. So first, we can start off with kind of a basic question so we're all on the same page. What is exactly medication overuse headache? So sometimes you'll hear it referred to as rebound headaches. I've heard some clinicians refer to it as drug-induced headaches. Basically, the overall picture of these headaches is that they're headaches that are caused by frequent use of an acute, sometimes called a rescue, headache medication. It occurs in people who have underlying headache disorders such as migraine or tension type headaches, or sometimes both. It occurs to a much less frequent degree with other types of headaches. So it presents with kind of a paradox because you're taking medications to stop the pain from your headaches, but in the end, you may end up causing more headaches. I just put here a table. It is out of the International Classification of Headache Disorders. So neurologists and other doctors will use this classification in order to diagnose different types of headaches. So a medication overuse headache has to meet these three criteria. The first criteria is headache more than 15 days a month in a patient who has pre-existing headache disorder. The second criteria that it needs to meet is that patient has regular overuse of headache drug more than 3 months. And there's a list here of a few, and we'll go through a slightly more exhaustive list in a couple of slides. And then the third criteria is no other explanation for new headache. There's also in this international classification, there's a couple of notes after the diagnostic criteria, which I thought was interesting to cover. So medication overuse headache is an interaction between an excessive use of a medication and a susceptible patient, which means that not every person who overuses these medications will necessarily develop a medication overuse headache. Some people are more prone to it than others. And then there is evidence that more than half of people who have headaches more than 15 days in a month have medication overuse headaches. So it's quite a large number of the headache population. So what causes medication overuse headache? So we are talked about this a little. It's a frequent use of pain medication, typically more than 10 to 15 days per month, depending on the type of medication. And this can cause a change in brain chemistry. The process is not well understood at this point. There are several theories as to why this happens. Medications, the overview, and then we'll go into a little more of the details, but is that medications can affect the pain pathways, and then the brain becomes more sensitive to pain. And then there's also an idea that of a withdrawal pattern in addition to that when you take these rescue medications and then the medications wear off, your headache returns, and then you want to use more medication in order to address that. So these are a few theories that research has addressed. So there's one that's called central sensitization, which means that your central nervous system goes into this hypersensitive state and your nerve cells become easily stimulated and your pain signals become amplified. And then there's a thought that it may alter your neurotransmitters in your brain. Specifically, research has been done about serotonin, that the receptors of serotonin get upregulated, and that may cause more pain. And then, sorry, I'm running out of breath. And then the altered pain processing theory, where the brain may process pain differently, which can lead to tolerance. So, because your brain gets used to having all this pain medication, you need higher and higher doses to achieve the same effect that you were achieving before with lower doses of medication. Here's a list of medications that can cause medication overuse headache. They're not all on there. These are the ones we see the most frequently. So if depending on the medication, you can see that they have different thresholds for causing medication overuse headache. So for some of them, if you take them more than 10 days in a month, you put yourself at risk of developing these medication overuse headaches. And for some others, like acetaminophen, NSAIDs, more like over-the-counter medications, 15 days a month is the threshold. What's interesting is the any combination of any of these together, if you take them more than 10 days a month, you put yourself at risk of medication overuse headache. And then the important piece is that over-the-counter medication that you do not need a prescription for, like the ones you see below, Tylenol, Advil, Excedrin, Standback, all of these can cause medication overuse headaches. So, what are some signs that you may have this diagnosis? These are things that maybe not all people will have this exact pattern, but they're definitely things to look out for. So, if you have daily or nearly daily headaches, sometimes you'll notice that headaches are worse in the morning. And then frequently you'll notice that medications only help very briefly, and then the pain returns, and then it's a cycle because you'll want to take more pain medication. Sometimes people will say that they start feeling dependent on their headache medication. So they say, if I miss a day of my headache medication, my headaches are going to get worse. So I just cannot miss a single day. And then some people start showing anxiety about running out of their medication. And that's kind of a red flag that you may be developing medication overuse headache. So, how do we break the cycle of medication overuse headache? So the first step is to recognize the problem. If you feel like you're having more than 15 headache days in a month, and you're taking too many pain medications and you're having some of the red flags that we talked about before, that may be that you're developing medication overuse headache. Step two is to withdraw the overused medication. safely, and there are several different ways to go about that. And that's a conversation between you and your neurologist as to how you want to address these medication overuse headaches. Sometimes we'll recommend stopping suddenly, or cold turkey is what we say sometimes. And sometimes we'll do more of a slow taper. We'll start another medication to try and prevent your headaches and slowly taper off the rescue medications. But in any case, you should expect a level of withdrawal headaches that can last from a few days to weeks after you stop taking the overused medication. And then step three, very important step that we'll cover in more detail, is preventing future headaches. So preventing this from happening again. So just a quick slide about what you can expect during withdrawal. That's not a fun time. It's probably the most difficult part of addressing medication overuse headaches. Unfortunately, the headaches may get worse before they get better. You can experience, in addition to the headache, you can experience fatigue, nausea, sleep changes, which are usually those symptoms, and the headaches themselves usually worse within the first 3 to 10 days. But those symptoms can last up to 2, and for some people, up to 6 weeks. The time varies depending on the agent that you're withdrawing from. So if it's triptans, which is one of the rescue medications for migraines, it can take, around 4 days versus typical analgesics like Tylenol, ibuprofen can take up to 10 days in general. This is not a rule. And then how do we manage withdrawal? We'll talk about it in the next slide. We as neurologists and physicians can suggest maybe using bridge therapies if your withdrawal headaches are really bad. So how can we, as your neurologist, support you? So we come up with a plan. If your withdrawal headaches get out of control, we should have a plan in place, and we'll help you through that, like making a good, robust plan. For some people who, very specific cases where it's very severe and they need IV medications, it's possible to do it inpatient too. So we touched a bit on this in the previous slide. We can help with bridge medications. So basically, these are medications to help in the interim while you're getting over these withdrawal headaches. Those medications can be long-acting, non-steroidal anti-inflammatory drugs like naproxen, long-acting triptans, which like frovatriptan, because it's long acting, it's not prone to these medication overuse headaches. For some of our patients, we've had good results with very short steroid courses with we usually do oral prednisone. And people feel better for a good length of time, and it helps them deal with those withdrawal headaches. And then sometimes we use antiemetics and fluids. So anti-nausea medication can help, and then fluids, especially if you're inpatient. And then the third strategy we use is to optimize your preventative strategy so that it doesn't happen again. So just to touch on what are some long-term prevention strategies. So we can use medications for this. So we can do a daily medication, which will reduce the number of your headaches. So instead of having a headache every single day in a month, we're trying to get that number down. and we're trying to get the severity of the headaches down. The most common or some very commonly used ones are amitriptyline, topiramate, propranolol, or sometimes we use the newer medications, which are CGRP monoclonal antibodies. You may have heard of them. Aimovig, Emgality are some options. There are plenty of other options in terms of medications. Those are just some commonly seen ones. For non-medication approaches, we always try to counsel on lifestyle changes. Sleep hygiene is very important, stress management, meditation, mindfulness. You can consider migraine diet, increase your hydration, regular exercise. We can also consider cognitive behavioral therapy, which has really good results in patients. We have a great therapist at the VA in Detroit, and patients rave about how it's helped them deal with their headaches. And devices, some patients really respond well to neuromodulation devices. We also, especially at the VA in Detroit, we also frequently do acupuncture, yoga, which people have really good results with as well. So why is this particularly important? It's to prevent relapse back into these medication overuse headaches. The relapse rate is anywhere from 22 to 42%, and it typically happens within a year of initially treating the medication overuse headaches. So when should you seek help for these types of headaches? So if you feel like you need acute medication and you're taking it more than twice a week and your headaches are worsening despite taking this medication more than twice a week, if you feel stuck in a medication cycle, you feel like you can never get ahead of your headaches, or if you're worried about being dependent on a medication or overusing a medication, those are all good reasons to contact your neurologist. So just some key takeaways for medication overuse headaches. They're fairly common and they are treatable. They're caused by the frequent use of acute or rescue headache medications. Very importantly, the neurologist will discuss with you that your headaches may get worse when you stop the overused medication. But we have bridge therapies and we have strategies to deal with that. The long-term solution in order to avoid a relapse are preventive medications, and then, as we just talked about, non-medication options. You don't have to live with these daily headaches, is the conclusion of this presentation. We have lots of options. Your neurologist can most certainly help you with these types of headaches. They're very treatable. And that's it. Thank you so much.